Assalamu alaikum. Ramadan Mubarak to all. We are here from Diabetes Service to discuss about diabetes and safe fasting in Ramadan. With me, Dr. Sandip Ghosh Consultant Diabetes Doctor, and I am Eman Abdullah, Diabetes Educator Specialist. Hi, Dr. Sandip.
Hello, Eman. It's a very important topic.
So can I ask you some questions? So my first question is, do all diabetic patients can do fasting, and do you have any plan to help our customer how to do safe fasting in Ramadan?
Okay, so your question has got two parts. One is whether all people with diabetes can do fasting in Ramadan, and how do they do it safely. So it's important to first remember what can go wrong in people with diabetes if they are fasting. So we know that the risks are, the things that can go wrong are, people can develop diabetic ketoacidosis or hypoglycemia or hyperglycemia or dehydration and some thromboembolic complications. So these are the risks for fasting, but this can be managed. So people, if they come for the assessment before Ramadan, we can advise them accordingly to do safe fasting to avoid these complications. Yes.
Okay. So also my question is about medication. So do they need any adjustment pre-Ramadan and during Ramadan? How we can help our customer?
Absolutely. So during Ramadan there is a long fasting period, so the medication regime will be quite different from the way people are taking medications during the normal time. So we know that certain medications can increase certain risks like hypoglycemia, low blood sugar risk if they are not taken properly. So we will like people to come and for a pre-Ramadan assessment so that they fully understand how their medicines work and when they need to take the medicines. So yes, it's a very important thing to remember that the medicines need to be adjusted during Ramadan, and they need to understand, have a clear understanding about how they can do this, and not only the medicines but their state of diabetes control at the moment, and in relation to that the medicines adjustment is very important.
That's why we are inviting our customer
Absolutely.
to come pre-Ramadan for checkup, screening, and
yes, we are asking our patients to come. Yes.
What about blood glucose monitoring? How often we need them to do blood test?
Yes, again, this is a very important question, and I suppose one size does not fit all. So the same advice would not be the advice has to be individualized. So it might vary from person to person, but generally we say that they would need maybe like 7 monitoring at least a day for say fasting, which would be like before suhoor, the midday, and then the mid-afternoon, then before iftar, and 2 hours after the iftar meal, and if they are not feeling well. So between 6 and 7 monitorings, readings would be required. But again, having said that, this will again be depending on someone's condition, someone's state of blood glucose control, the medications they are taking. So it might vary, but this is the general advice.
Okay. So also we need to ask about the complication. So there is any complication can be happen for during fasting period?
Yeah, as I discussed in your first question, what are the risks? Why? What are we trying to achieve? So what we're trying to achieve is to minimize the risk of these complications, and these complications are hypoglycemia, hyperglycemia, which means very high blood glucose, then diabetic ketoacidosis or any dehydration from high blood sugar and fasting and thromboembolic complications. So these are the main risks that are there in relation to fasting in people with diabetes who are on medications, and we are trying to minimize this risk.
That's why we ask our customer to break their fasting immediately if they face any high sugar or low sugar. And my last question for you, doctor, about the insulin pump. So here in Zulekha Hospital, we have so many patients there on insulin pump. There is any preparation for them also to do safe fasting in Ramadan?
Yeah, it's absolutely important that they come and visit the diabetes healthcare professionals, like yourself and their doctors and the dietitians, because if they have got a good control, they can do fasting even with insulin pump. That's not a no for fasting. So the more they understand the condition and how they can manage and how they can seek help from us on the diabetes team, I think they would be in a better position to observe the fasting in Ramadan.
Yeah, that's good. Thank you, Dr. Sandip. If you have any question for me?
Yes. So just as we discussed about the complications. So I think it would be useful for people to understand how they can prevent the complications. If you can just give some idea about that, especially if you can give some advice regarding diet and fluid intake during Ramadan.
So as we know that diet is very important and very working as a very essential role in controlling diabetes. That's why we ask our customer to follow healthy and balanced diet during Ramadan and in normal days. So health and balanced diet means, especially in Ramadan, take iftar as early as possible, take suhoor as late as possible, don't escape your suhoor, avoid any sugary and saturated fats or oily food, try to take healthy plate. Healthy plate means half of vegetable, a little of starch and protein, not in fry option. Also take suhoor at the same pattern, snacking between iftar and suhoor. Snacking means follow healthy snack like maybe fruit or salad or vegetable. Related to fluid intake, we recommend also to take enough water between iftar and suhoor, at least to be more than 2 liters during this time to avoid dehydration.
Okay, so that's about the food. Now, what about exercise? Can they do exercise, and when would you recommend?
Exercising is very important for diabetic patients. They need to do it, and during Ramadan time we recommend exercise between iftar and suhoor, and tarawih is a part of the exercise. So we advise also to avoid exercising or heavy exercise the period before iftar, because in this time maybe sugar level will be low, so there will be highly risk for hypoglycemia. And we advise also to be more active during fasting period, because some of them they are really relaxing or sleeping. This is we doesn't like, so we like to be active normally.
Okay, now then after exercise, what about sleeping? Can you?
So related to sleep, this is also very important to inform about it. So we doesn't like to sleep period to iftar, because between Asr and Maghrib, this area maybe blood sugar level will be in lower side. So maybe they will get hypoglycemia and they are not aware about. So can happen diabetic coma or some complication. That's why to be awake in this area, either you do some activity or work or watching some TV. Yes.
Okay, so that brings us to the next point about hypoglycemia. How can people minimize the risk?
Yeah, hypoglycemia is one of the complication and the risk of fasting. So all diabetic people should be aware very well about this. So hypoglycemia means the blood sugar level will be less than 70 milligram per deciliter, and it can happen during fasting period if a patient escapes their suhoor or very light suhoor or overdose of medication, or they have heavy exercising, so they can drop their sugar. That's why healthy lifestyle very important to follow during fasting time. And the causes for silent symptoms, the patient can feel like shivering or sweating, palpitation, drowsy, dizziness, any feeling anything not okay. They should monitor sugar, check sugar. If sugar less than 70, they can take juice like half glass, wait for 15 minutes and check sugar again. If it's still less than 70, they need to repeat again juice and wait 15 minutes and check until they can correct it. And they need to inform their healthcare provider team if they can adjust the management.
Next, we move on to hyperglycemia. I think what would you advise people to about hyperglycemia, high blood glucose?
Yeah. So high blood glucose is one of the complication also and risk of fasting. High blood sugar means it's more than 300 milligram per deciliter during fasting period. If they have this, they should break their fasting immediately, and they should correct it by drinking more water, taking medication if they are missing. And high sugar means they can feel some symptoms like headache, like numbness, upper or lower limb, dryness in mouth, more urination. So any symptoms like that, they should check. If above 300, they should break their fasting immediately and correct it, and they should report to their healthcare provider team to adjust the management. And please also the advice related to high sugar or low sugar or dehydration or diabetic acidosis, please you need to break fast immediately. So if you really delay negligence, means you are in risk.
The message is therefore that if you have diabetes, do come for a review and know exactly what is best way for you to approach this fasting period.
It was really nice, Dr. Sandip, and thank you. Thank you to all, and pray for all of you to be safe fasting in Ramadan, and taqabbal Allah min al-jami'. Thank you.
Thank you very much.